Good morning, students. Today we will learn about the Unit 4 of the Obstetrical and Midwifery Nursing, that is, the physiology and management of the normal puerperium. So, in this chapter, we will include the all organs, reproductive organ, how it revert back into the non-pregnant state. Okay. So, after the postnatal period, how the all organs are in become normal in pre-pregnant state. So physiology and management of that normal puerperium period. So first of all, we will learn about the normal puerperium. What is normal puerperium? So introduction. The puerperium is a period of approximately 6 weeks in which commence following the completion of the third stage of labor. Oh, okay. So after the third stage of labor, delivery of the baby and delivery of the placenta is already done. So after the delivery of the baby, till the 6 weeks of the till 6 weeks is known as a normal puerperium period. So the period of the baby delivering and approximately till 6 weeks it known as a puerperium period. So during this time women recover from the stress of the pregnancy and delivery, and the physiological adaptation which occur during the pregnancy subside, facilitating and the restoration of the non-pregnant state. As I told earlier that during the whole pregnancy phase, women have to suffer many problems, okay, and many signs and symptoms. So after the delivering of the baby, women recover that all stress of the pregnancy and delivery, and also physiological adaptation which occurs during whole pregnancy and subside, the facilitating the restoration of the non-pregnant state. Okay, so this is known as a puerperium period. While the baby is delivered, till 6 weeks of that period, duration of time is known as the puerperium period. So, different type of obstetrician and gynecologist given the definition of the puerperium. That is, first definition is given by E.M. Simmons. That is, the puerperium is defined as the 6 weeks of period commencing after the completion of the third stage of labor. So, he defined that after completion of the third stage of labor till 6 weeks till 6 weeks period is known as a puerperium period. Second one is a Philip and Baker. He is given the define, that is, the puerperium is referred to the 6 weeks period following the childbirth when considerable adjustment occur before return to the pre-pregnant state. So all are given the same define because the meaning of the puerperium is same itself. Okay. 6 weeks is known as a normal puerperium period. Means after following the childbirth, refer to the 6 week period is known as a puerperium. And last one is the puerperium is defined as the time from delivery of the placenta through the first few weeks after the delivery. Few weeks means 6 weeks. Okay. So it is known as a puerperium. So this is the introductory portion and the normal define of the what is puerperium period. Next, the puerperium period is the period of time following the delivery of the child during which the body tissue, especially the reproductive system, revert back to the pre-pregnant state or non-pregnant state, both anatomically and physiologically. Yes, in this whole puerperium period, not only some organs or tissue become in non-pregnancy, but whole reproductive system is converted into revert back to the non-pregnant or pre-pregnant state, both anatomically as well as the physiologically. Okay, so it is the period of the adjustment after pregnancy and delivery when anatomically and physiological change of pregnancy are reversed, the body return to the normal non-pregnant state. In that we include that the reproductive tract return its normal and non-pregnancy state. Okay, so we learned that the what is the actual puerperium period. It is defined as the after completion of the third stage of labor or delivering of the childbirth or placenta till 6 weeks. It is known as the postpartum period. And in postpartum period, the after the postpartum period, the delivery of the child during the body tissue membranes, and whole reproductive system is revert back into the pre-pregnant state, both anatomically as well as the physiologically. Okay. Next one, the stages of the puerperium period. So, what are the stages of the puerperium period? So, here it is divided into the three parts. Okay, which three stages? The postpartum period has been divided into three. That is immediate, early, and remote, or we can say immediate, remote, and recent. Okay. So, what is the immediate puerperium? So, the first 24 hours after the parturition. Parturition means the delivery whole process of the delivering of the baby, or delivery of the baby, or pregnant after the pregnancy, completion of the third stage of labor, while the woman delivering a baby, till 24 hours. Okay, after the delivery of the birth of the baby to the 24 hours, it is known as a parturition. So after parturition period to the 21st 24 hours, it is called as the immediate puerperium state. And when acute post anesthetic or post delivery complications may occur, we all know that in pregnancy or in labor, that is not that much easy. Okay, so whole throughout pregnancy and after delivery, women have to suffer many problems. So if any complication throughout delivery or post anesthetic problem, then till parturition to 24 hours, it is known as the immediate puerperium. And second one, the early puerperium. Early puerperium, which extend until the first week. First immediate is up to 24 hour. Early puerperium is up to the first week, and the remote up to the period of time required involution of the genital organ through the 6 week of the postpartum. It means in definition we already learned that the puerperium period is defined as the post defined as the following childbirth to the 6 week. Okay, so till 6 week of the postpartum period is known as the remote puerperium period. So, is that clear? The stages of the puerperium, that is three: immediate, early, and remote. Immediate period up to the 24-hour after the delivering of the baby. Early puerperium, which extend to the first week of the postpartum period, and the remote puerperium is up to the 6 weeks of the postpartum period. Okay. Next one. Huh. Yes. So next one is the which organs or which reproductive tract involved into the postpartum or puerperium period. So which are the organs revert back into the non-pregnant or pre-pregnant state. So we will see about the how anatomically and physiologically it reverts back into the normal stage. Okay. So first of all, in reproductive system we will learn about the different organs of the reproductive tract. So first of all, the uterus. So in uterus, involution. So the meaning of the involution, it is the return of the uterus to a non-pregnant state after the childbirth. So after the childbirth, how uterus it becomes in a non-pregnant state. So it is known as the involution process. Uterus become non-pregnant state after the childbirth is known as the involution period. So this process begins immediately after the expulsion of the placenta with contraction of the uterine smooth muscle. So we already know that after delivering of the baby in 30 minutes or half an hour, delivery of the placenta will take place. Okay. So after the delivery of the or expulsion of the placenta, the process begins the contraction of the uterine smooth muscle. So this process is also done by the process of the involution process. At the end of the third stage of labor, the uterus is in the midline about 2 centimeter below the level of the umbilicus and the weight 1000 gram. We already know that the whole organ is developed and uh, throughout the pregnancy, but after the delivery of the baby and placenta, the uterus become in non-pregnant state. So 2 centimeter below the level of the umbilicus and weight is the 1000 gram. Okay. By 24 hours of the postpartum period, the uterus is about the same size and it was the 20th gestational weeks. So the level of the uterus becomes the 20th gestational weeks after the 24-hour of the postpartum period. So the fundus descending about the 1 to 2 centimeter and every 24 hours, and by the 6th postpartum day it is located halfway between the symphysis pubis and the umbilicus. So here the size and the actual position of the uterus is given. It is that the fundus descend in about 1 to 2 centimeter every 24 hours, means every day, and by the 6th postpartum day, it means the 6th day after the delivery of the baby, it is located into the halfway of the between the symphysis pubis and the level of the umbilicus. Okay. So this is the position of the uterus. Now how involution takes place into the uterus. So return to the pelvis by the about 2 weeks. It means it takes place 2 weeks for the returning back into the normal smooth muscles of the uterus. Then it be at the normal size by 6 weeks. We already know that the postpartum period takes place at the 6 weeks. Normal 6 weeks period duration of time takes place. So normal size is returned back by the 6 weeks. Then the weight changes of the uterus. Obviously now the weight of the uterus become in a non-pregnant state. So 1000 gram immediately after birth, excluding the fetus, placenta, membrane and amniotic fluid. So 500 gram 1 week after birth, 300 gram less 2 weeks after the birth, and 50 gram 6 weeks after the birth. So this kind of the weight is relieved into the uterus. Okay. So the endometrial lining rapidly regenerated. Now endometrium layer, the innermost layer of the uterus is endometrium. So the lining of that layer rapidly regenerated by the 16 days, and the placental site undergoes a series of changes into the postpartum period. Placental site undergoes series, means the actual position of the placenta is undergo into the postpartum period changes. Okay. Next, so in this image we can find that the by day 1 to 2 centimeter uterus it is decreased. So first day the level highest, then second day low, third day very low, fifth day descending, seventh, 10th day. So by day it becomes into the non-pregnant state of the uterus and uterine muscles. Okay. Next. So it's the fundus level approximate that of the 20-week pregnancy at the level of the umbilicus, and the end of the first postpartum week it is palpable at the symphysis pubis. Means after the completion of the first week, it is palpable at the level of the symphysis pubis. Okay. Now the autolysis. What is the meaning of autolysis? So it is the self-destruction of the excess hypertrophied tissue. Hypertrophies means increase the size of the tissue. So it very number and size of the tissue will be increased. So it is self-destruction, means destruction of the tissue will be occurs. So it is the process of autolysis. Then second one, sub-involution. So involution means we already learned. Uterus become in non-pregnant state is known as the involution. And what is the sub-involution? Failure of the uterus into revert back of the non-pregnant state is known as a sub-involution, means opposite of the involution process. Okay. The most common causes of the sub-involution are retained placenta, fragment and the infection. Yes, this is the most important point. We will mark that. Okay. So what is that? Why the sub-involution process takes place? So due to the placental involution or retained placental beads into the mother's cavity, so infection takes place. So due to that infection, the sub-involution process takes place. Okay. Now the contraction. So the hormone of the oxytocin strengthen and coordinate uterine contraction, which compress the blood vessels and promote the homeostasis, means the balancing the between the membranes and the contraction. Okay. So the hormone oxytocin is released for the strength and coordination between the uterine contraction. Due to the oxytocin releasing, the uterine contraction is maintained. So the compression of the blood vessel and promote the hormone. During the first to second postpartum hours, uterine contraction may decrease in intensity and become the uncoordinated. Means after the completion of the delivery or delivery of the placenta into first to postpartum hours, the coordination between the hormone oxytocin and the contraction is uncoordinated, means decrease in intensity, and the pain or contraction is a decrease. Okay. Exogenous oxytocin is usually administered immediately after the expulsion of the placenta to the maintain uterus firm and contracted. Means the oxytocin is while administered to the woman, the expulsion of the placenta maintain the uterine firm and contracted. So the mothers are encouraged to push the baby and to breast immediately after the birth to stimulate the release of the oxytocin. Yes, the main action of the oxytocin is releasing the contraction or producing the contraction and maintain or coordinating it. So after the delivery of the baby, oxytocin also encourage mother for the baby to breastfeed after the birth and stimulate releasing of the oxytocin. Okay. Now placental site. So what is the placental site? Immediately after the expulsion of the placenta, membrane, vascular constriction and thrombosis cause the placental site to be reduced to an irregular nodular and elevated area. Means after the delivery of the baby, delivery of the placenta will be takes place in half an hour. So after the expulsion of the placenta, whole membrane, vascular constriction all are removed. Okay. So the placental site is already reduced and irregular. It becomes the irregular and nodular. So upward growth of the endometrium causes the sloughing and necrotic tissue and prevent the scar information. So it can how it works, that is the upward growth of the endometrium layer and it causing the slugging and necrotic tissue, means dead tissue, and prevent by occurring that prevention of the scar is takes place. So endometrial regeneration is completed by the postpartum day at the 16, and except the placental site is not complete until the 6 weeks after the birth. Okay. So this is about the reproductive organ, that is the uterus, placental site. Okay. So in next session we will learn about the next organs also. Thank you. If any doubt, then uh, please tell me. Okay. Further in session we will learn about the next organs of the uterus and reproductive tract. Thank you.